Hello again. Now, the National Department of Health has announced that 80,000 doses of the Pfizer vaccine are due to expire this Thursday. The department says it's exploring strategies to increase vaccine uptake, especially among the 18 to 34 age group. Health expert Professor Mosa Moshabela is calling for vaccine equity and justice, appealing to the public not to let doses go to waste. He's joining us now on the line. He's, of course, the University of KwaZulu-Natal's Deputy Vice-Chancellor in the Research and Innovation Department. Prof, good afternoon. Thank you very much for your time. What's your reaction to this? Should more have been done to make sure that more people got vaccinated and that these doses are not about to expire now?
Good afternoon, Bredan, and to the viewers. I think my reaction to this has been a feeling of disappointment, I think, for the most part, because in a way we don't want any doses to go to waste. And especially because you'd recall that last year we were also kind of sending strong messages to other countries, especially Western countries, who were keeping vaccines to themselves and hoarding them and not sharing with us in Africa. But now, you know, in South Africa, we have the privilege of having a lot of doses, but we know that for the most part, Africa as a whole has not been adequately vaccinated. And for that reason, we shouldn't have a situation where vaccine doses go to waste. But I also sympathize with the people who are doing stock management, because in a way, it's difficult to predict how people behave, whether people are going to take up vaccines or not. But nevertheless, they knew that these vaccines are going to expire, and we would have expected them to do something to salvage the situation such that these vaccines do not go to waste. So I do expect that more could have been done, at least for these 80,000 doses, to not necessarily go to waste, as now is going to be the case.
What does expire mean in this case? I mean, I'm not a medical person. Does it say on that date it's dead and gone, you can't use it and that's it? Or is there a little bit of leeway during which there could be a campaign to get them into people's arms?
Yeah, on these 80,000 doses, there's no more leeway. These are doses that, have already been taken out of the deep freezer that is often used for Pfizer. And they're just waiting for their expiry date on the vials, which is the 31st of March. And we cannot go beyond the date in this case. And also, it also means that, you know, even if you were to take them to other countries, those countries would have needed to have the cold chain that can be used for Pfizer and the sort of minus 70 degrees. These things become difficult in Africa, as we have already established. Nevertheless, I think that on the 31st of March, beyond that date, we will not be able to use this vaccine doses. This is the message we have received.
So I mean, it's a lot of money as well. I don't know how many millions these 80,000 Pfizer doses would cost, but I hear that the department is talking about a strategy to increase vaccine uptake among the youth, particularly between the ages of 18 or 34. But you've got a few days to go. I wonder if that is feasible at all. Yeah,
this efforts that government is engaging in, it's beyond this 80,000 doses. I think that the one thing that I have noted is that they are just concerned about the age distribution. We've seen that, and amongst the people who are 18 to 34, the uptake is very low at around 30%. And so they are trying to increase that uptake. It's good. I think that government should try and increase that uptake. But I also think that, it's a little bit too late, because most of the people in that age group were really affected by the negative information that came out, especially in social media, the misinformation, the sort of anti-vaccine messages that were prevalent. And I don't think that government did enough to counter those specific messages. I don't think that they did enough to sanction people who were pushing those messages and hold them accountable. And for that reason, I think that we have put ourselves in the foot.
Yeah, you've called for vaccine equity and justice. You're among those voices around that issue and making an appeal for people not to let a vaccine stock go to waste. You sort of repeated that now when you were answering my first question, expressing your disappointment that we've come to this point. I mean, there is COVID fatigue, if I can use that expression. People, that's why we were so relieved last week when the president said, you don't have to wear your mask anymore when you're outdoors, but when you are indoors, please do wear them. And the rest of your non-pharmaceutical interventions must continue, sanitizing, washing our hands. But what can be done, you think, Prof, for people to be inspired or encouraged, maybe it's a better word, to vaccinate?
Yeah. But my biggest concern is that we are now a year into the vaccine rollout since we started with the rollout of Johnson & Johnson among nurses. And most people who are activists, who are vocal, who are influential, powerful, and have resources, they are vaccinated. So the voices are dying down in terms of pushing for vaccination. And unfortunately, the people that are not yet vaccinated are the vulnerable groups. And this is my concern, is that, part of the fatigue that is happening around the vaccination is the fact that the people that actually need the vaccination, and they don't necessarily have the voices to continue with being vocal in the way that we were vocal, all of us, when the vaccine doses were not yet available. And I think that the government needs to understand this and make greater effort in making sure that those vulnerable groups are reached. The people who are of poor socioeconomic status are reached, including using incentives that are appropriate, not the ones that they've been trying, and also making sure that where it's necessary, they can use mandates to also encourage vaccination as well.
Prof, thank you very much for your time and your insights. As usual, Professor Mosa Moshabela, Deputy Vice-Chancellor at the University of KwaZulu-Natal's Research and Innovation Department.